So good afternoon. My name is Aaron Huff, and I'm a health services consultant with the Washington State Healthcare Authority. Thank you for attending our June 15th webinar on the Diabetes Prevention Program. I would like to take just a little bit of time this afternoon with you to discuss Healthcare Authority's Diabetes Prevention Program. Specifically, we will cover some background information on diabetes and prediabetes. We'll take a look at some of the national and local statistics. Next, we will review the current DPP program. Then we'll dive into what you can do to help with the DPP program. And lastly, we'll take a look at some common questions related to privacy and other questions that we have received before from the program. Throughout this webinar, please feel free to send your messages to us, and my coworker Jennifer will compile those messages and we'll address those at the end of the webinar. Okay, so let's dig a little bit into what diabetes is. Diabetes is a term we all have heard far too often. Simply put, diabetes is a condition characterized by hyperglycemia resulting from the body's inability to use blood glucose for energy. Typically, this is a chronic disease in which there's high levels of glucose in the blood. Insulin is a hormone that helps our body use glucose for energy. Insulin is made by the pancreas, and it is an essential hormone that brings blood sugar into your body cells. Glucose is another term that we'll hear throughout the presentation. And glucose is a simple form of a sugar and one of the main sources of energy for our bodies. The brain uses about 20% of the glucose that our bodies produce. So let's talk a little bit about type 1 diabetes. Type 1 diabetes is usually diagnosed in children and young adults and was previously known as juvenile diabetes. About 5% of people with diabetes have this type. With type 1, the body does not produce insulin. Technically, what really happens is your body breaks down sugar and starches that you eat in a simple sugar known as glucose. Insulin is used to grab the glucose from the bloodstream and transport it to your cells for energy. With type 1 and the lack of insulin, your body cannot effectively do this. So this picture on the right kind of is a graphical presentation of where glucose is not binding to insulin and therefore does not get absorbed into the cells. So it kind of gives you a little bit of a visual in terms of how this actually occurs. So some people who have hypoglycemia. So what does this actually look like? So here's an illustrative guide to some of the symptoms that you would typically see with somebody who has hypoglycemia. This is called hyperglycemia. Type 2 diabetes is the most common form of diabetes that we have. It is essentially what happens is the body is resistant to insulin. What happens is that your pancreas makes extra insulin to make up for the added glucose in the bloodstream. Although a short-term fix, over time the pancreas is not able to keep up and make enough insulin to keep your blood glucose at normal levels. And so if you look to the right, here's another kind of a graphical presentation of what type 2 diabetes looks like with somebody in their bloodstream. So you'll see that on the left side is the normal process where you have glucose and you have insulin that enters into the bloodstream. And then with someone who's insulin resistant, you'll notice on the right that the glucose stays in the blood and it doesn't get absorbed. You'll kind of see those three little groupings there on the right-hand side that kind of indicates where they go into the cells. So what does it look like with somebody who has hyperglycemia? So here's kind of an illustrative guide to kind of demonstrate that. Some of the symptoms are the same, but there are some differences. Dry skin, for example, needing to urinate often, blurry vision, and our slow healing wounds. So now that we have learned a little bit about diabetes, let's take a look at some of the stats regarding it on a national level. Although the numbers are falling in regards to diabetes, they are still very, very high. Type 2 diabetes accounts for about 90% to 95% of all diagnosed cases of diabetes, and type 1 diabetes accounts for about 5%. The health economic costs for both are enormous. Diabetes was the 7th leading cause of death in the United States in 2013, and this actually may be slightly underreported. In addition, diabetes is the leading cause of kidney failure, lower limb amputations, and adult onset blindness. More than 29 million US adults have diabetes, and 20% of healthcare spending is for people with diagnosed diabetes. So let's kind of bring this home a little bit and kind of see what this actually looks like in terms of Washington. If you combine type 1 and type 2 diabetes, we have about 627,000 people in our state who fall in this category. So that's really about 1 in 9 people. So to take that a step further, of those 1 in 9 people, or of those people who have diabetes, 1 in 4 don't even actually know that they have diabetes. And right now, I think we have about 20 or so people who are joining us on the webinar. So if you were to kind of take the stat and bring this home a little bit further, it would really be about 2 out of the people who are joining with us on the webinar have type 1 or type 2 diabetes. The cost of diabetes is tremendous. Individual medical costs of having diabetes reaches nearly $14,000 per year. And surprisingly, this is 2 times higher than for people without diabetes. And what's even more kind of a shock is the risk of death for adults with diabetes. Oh my gosh, it's like 50% higher than for adults without diabetes. So clearly this is a huge problem that we have, not just in Washington state, but also nationwide. So now that we've learned a little bit about diabetes, let's take a look at prediabetes. Prediabetes is when the blood sugar is high, but not high enough to be considered type 2. Prediabetes is treatable with proper intervention. Without it, it's likely to turn into type 2 diabetes, and there is a greater risk for heart disease and stroke. A person with certain risk factors is more likely to develop prediabetes than type 2 diabetes. These risk factors include age, especially after 45 years of age, being overweight or obese, a family history of diabetes, having an African American, Hispanic, Latino, American Indian, Asian American, or Pacific Islander racial or ethnic background, having a history of diabetes while pregnant, known as gestational diabetes, or giving birth to a baby while 9 pounds or more, and being physically active less than 3 times a year. 86 million people have prediabetes, which in the US is about 1 in 3 US adults. So let's take a look at what this looks like in terms of prediabetes for Washington state. So there's currently right now it's estimated that there's 2 million people in Washington state who have prediabetes, which is about 1 out of 3 adults. Of those, only 1 out of 12 are even aware that they have prediabetes. With weight loss and moderate physical, or without weight loss and moderate physical activity, about 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years. I'm not sure about you, but this was an alarming statistic that I read and really speaks to what we really need to do in Washington in terms of helping curb the statistics. So let's take a look at what the diabetes prevention program really is. It is a CDC recognized program, nationally recognized evidence-based lifestyle program, which has been proven to delay or prevent the development of type 2 diabetes among people with high risk. You do have to qualify for the classes, and an example of qualifying would you have to be testing as pre-diabetic, and there's some other qualifiers as well, which I'll cover shortly. The classes consist of 25 one-hour sessions, and typically these are year-long, and there's 16 weekly classes, and then three every other week, and then lastly there's 6 monthly classes. There is good communication with your physician. The Y does work really hard to help your physician understand your progress and where you're at in the program. The program itself is better than medication. I mean, you're learning a lot of tools that you'll need in life to help make lifestyle changes, which is something medication can't do for you. The DPP program typically is done in a class setting, and the sessions consist of live, specially trained lifestyle coaches. Classes are at community locations and/or employer work sites. Having worksite locations is a great way. We encourage organizations to do so if it's an option. Not all the time does it work in our organizations, especially some of our state agencies and smaller higher education institutions where it's just not logistically possible to have hold these classes just because of limited meeting space. In the event that happens, the Y does hold these classes outside of the organizational area, and we'll work with them to coordinate that as necessary. The classes have tracking tools, and you can receive measured results to track your own progress. And then the classes also contain tips and tools for healthier living. The program goals for the diabetes prevention program really is pretty simple. They strive to have a 7% weight loss. They really would like to have less than 25% fat calories. And then their goal is to have greater than 150 minutes of weekly physical activity. So now that we have some background information about diabetes and some stats, let's take a look at where the program is housed at and some of the background info that will lead us to the current program. So what is the Public Employees Benefit Board? The Public Employees Benefit Board purchases and coordinates health insurance for eligible public employees and retirees. Within the PEB is Washington Wellness, where we run the diabetes prevention program. We work with three major groups: state agencies, higher education institutions and/or technical colleges, and some organizations representing civil service, counties, municipalities, tribal governments, and then some school districts. Altogether, there's approximately 369,000 enrollees across 2 insurers and multiple plans, and the largest number of those insurers or those enrollees are in the Uniform Medical Plan. So here's kind of a table that provides a snapshot of our PEB population from 2014 till about the middle of the second quarter of this year. The first column you'll see is the total number of PEB program members. So you'll kind of get an idea of what our total population is. And then the next column over, the middle one, is the number of members meeting criteria for the DPP coverage. So that is, they're 18 years of age or older, they're enrolled in the PEB medical plan, and they don't have Medicare as a primary insurance. And then the last column on the right is really the kind of column to hone into. This is the number of PEB program members with prediabetes who are eligible for the DPP as a covered benefit. So as you can see, in 2017, we're sitting at pretty close to 73,000 people, approximately, who have prediabetes who would be eligible for the diabetes prevention program. So let's take a look at what this is in at DPP in Washington State. So just a little bit of background information on DPP. How did it actually really start? The Office of the Insurance Commissioner wanted HCA to look into start purchasing value-based strategy rather than a fee-for-service. We identified that King County was using the diabetes prevention program and modeled ours very similar to theirs. A contract between our PEB health plans and the Diabetes Prevention and Control Alliance, DPCA, took about a year to execute and needed to be signed off by the Office of the Insurance Commissioner. The Diabetes Network leadership team was a big advocate for the program, as was a strong commitment from our HCA's medical officer. Planning for screening events began in late 2013 in advance of medical availability in 2014. YMCA took on a majority of the DPP classes, and the Washington State University began offering DPP program in areas that were not covered by the YMCA's. Thanks to a persistent voice with the Public Employees Benefit Board and the Diabetes Network Leadership Team's vision and the governor's executive order, we were able to successfully start the diabetes prevention program in 2014. So let's take a little bit about who our DPP partners are now. What we had a couple years ago is slightly different than what we currently have moving into 2017. Beginning in 2017, the diabetes prevention program structure we had changed as DPCA dissolved and YUSA took over. With this changed, we have different partners. The wellness coordinators play a big role in helping us implement the diabetes prevention program. In order to reach all those eligible for the program in our organization and the approximate 72,000 people with pre-diabetes, we really need your help, and so we really rely on you guys, the wellness coordinators, to help us with this. Working with the wellness coordinators is a Washington wellness team consisting of Ron, Pam, Susan, Justin, and myself. This team provides technical support and works closely with the wellness coordinators. Also partnering with us is YUSA. And just a little bit of information about YUSA. They were founded back in 1844, and YMCA is one of the nation's leading non-for-profit strengthening communities throughout youth development, healthy living, and social responsibility. In the U.S., the Y is comprised of the YMCA of USA, a national resource office, 2,700 YMCAs with approximately 20,000 full-time staff and 600,000 volunteers and 10,000 communities across the country. The Y engages 9 million youth, 13 million adults each year in the U.S. and serves more than 45 million people in 119 countries. The Y has a long-standing relationship and physical presence, not just to promise, but to deliver lasting personal and social change. The Y is guided by 4 core values: caring, honesty, respect, and responsibility. The diabetes prevention program and their services are provided through a network of 253 local YMCAs across the country via in-person classes at YMCA's employer or community sites. Also, one of our very important partners is WorkWell Consultants. WorkWell Consultants is an employee health management company that provides biometric screening statewide. They do not contract out their own services. WorkWell Consultant screeners are employees that have varying backgrounds in health education, such as emergency medical technicians, certified nursing assistants, registered nurses, dietitians, personal training, and so on. Each screener goes through an extensive training program to ensure they are well versed in the background knowledge needed to explain the results of the participants and properly perform the screening test. During the testing event, WorkWell Consultant screeners have about 10 minutes with each participant, and essentially their goal is to complete the screening and explain the results in a way that helps the employee understand their risk profile and help them feel empowered to do something positive about their results. Their staff is not only professional, but engaging and personal. So how is the DPP actually really offered? Wellness coordinators, what happens is the wellness coordinators are going to request like a fasting blood glucose testing event, very similar to what we have done before. Then what will happen is the wellness coordinator, the representative from Washington Wellness, YMCA, and the WorkWell consultant will get together and we'll coordinate the testing event, which we typically call during our implementation call. Wellness coordinator, after the implementation call, the wellness coordinators will promote the event and then until the event actually takes place. Once the event takes place, then there's several other follow-up items which we'll talk about shortly. Those who qualify as pre-diabetic are linked to the YUSA classes. Those who were not tested as pre-diabetic or diabetic could then just return back to their office or wherever it is that they came from. So who can participate in a DPP screening event? So they need to be adults 18 years of age or older. They must be enrolled in a PEB program medical plan. And then they cannot have Medicare as a primary insurance. And so oftentimes we get asked whether family members or dependents can participate. As long as they meet these criteria, then they still would be able to participate in your event. So who can participate in the DPP classes? So meeting those same 3 criteria, you could have a self-reported body mass index of 25 or higher. or 22 or higher for Asian ethnicity, Hispanic Latino, or American Indian. Previously self-reported diagnosis of gestational diabetes, or one of 3 different blood tests. And one of those could be a fasting glucose with a range of 100 to 125, post-eating about 2 hours if your range is about 140 to 199, and then with a glycated hemoglobin A1C with a percentage of about 5.7 to 6.4. So any one of those 3 tests would also qualify you to participate in the class. And in addition to that, if one of those tests were not able to be done, we also have the CDC risk quiz, which if somebody scores 9 or higher on that, they can also use that as a way to get into the classes as well. So what happens at the DPP screening event? So here's what happens is an employee is going to check in. The WorkWell consultants will document the information about the employee. They'll do their height and weight and whether they are fasting or not. If they have not fasting, WorkWell consultants will still allow the individual to take the test, but it will be important to make sure that they're aware of that their results could be elevated since they didn't fast, and depending on what that result is, usually if it's about 125 or higher, then they would ask to get referred to their physician for follow-up. So providing that they have fasted, they'll get called to actually take the glucose test, which is it's a simple finger poke. The results are ready in about 90 seconds or so, and then we record the results. A really important point I want to make to you guys is that the type of test that we're doing this year and probably subsequent years is going to be a little bit different. We are doing a fasting blood glucose test. We're not doing the A1Cs anymore. So as you're thinking about how this is going to work, we want it to be about 8 to 10 hours before they actually get tested, no food or water. So when you're thinking about having your testing events, think about how that time frame is going to work best for your population. Once everything has been recorded, the employee does get a copy of the results, and WorkWell Consultants keeps a copy for the purposes of billing. So just a little bit about the blood glucose test. Previously, we did use the A1C test, and the little picture there that you see on the right, that's actually a picture of the actual device that they will actually use. So it's very quick finger prick and you're good to go. FDA did not approve of the A1C for diabetes diagnosis, or they did approve it for diabetes diagnosis only, not for screening, which is why we're moving away from A1C and doing a fasting blood glucose test. So that'll be the new method of moving on. Good thing is that with this test, you still get your results in about 90 seconds. So here's kind of a chart that kind of explains a little bit about where people would fall using this type of a test. So normal range, fasting is between 7 and 100, and then post-eating 2 to 3 hours, you're about 120 to 140. For pre-diabetes, you're about 100 to 125, and post, you're about 140 to 160. And then if you were tested in the diabetic range, it would be expected to have a fasting glucose level above 125 or higher. So let's take a little bit at the DPP data that we have. So this is from years 2014, 15, and 2016. This is kind of what it looked like for our class participation. So the blue line indicates the DPP enrollment, the number of people who actually enrolled and participated in the DPP screening event. So we had just a little over about 550 or so in 2014. The green line is the DPP participation. So this is those people who actually read and who actually registered and took at least one class for the YMCA. And that was, about 450 or so. And then the other color that we have there is DPP completion. So this is those who actually completed the 9th class or more for the YMCA. And so over the last couple of years, you can see that our numbers have subsequently kind of dropped down, and we're really trying to get our numbers back up there and get as many people tested, which is why we're kind of bringing awareness through this webinar, and we could really use your guys' help accomplishing our goal. So a little bit about some of the weight loss that we've seen. It is working. The weight loss of greater than 5%, which is our blue line. In our first year, it was almost 100 people who had that, which is phenomenal. and then the green line is weight loss, which is greater than 9%. So again, this kind of follows the same trend as the previous graph. So what can we actually really do about getting more people involved with DPP and helping reduce the diabetes rates that we have in Washington? Well, you can start with a diabetes awareness campaign. Commit to holding a testing event in your agency. Work with your wellness team, work with your senior leaders, and commit to holding one within your agency. You'll be able to find a step-by-step guide from the Washington Wellness DPP page, and we're actually going to take a look at that here. And just give me a second to bring this up. Okay, hopefully y'all can see this web page. This is our diabetes prevention web page that we have. As you go through here, it's all kind of broken down into 4 easy steps for you to follow. So there's a plan and schedule area. There's 3 different steps within here to help you plan and schedule your event. You can look at the executive order that the governor has, 1306. You can use that to kind of leverage support for the diabetes prevention program. We also have a wellness coordinator's checklist. This checklist is a great way, and it goes through all the different components that you need to think about getting one started, to holding the event, promoting the event, and post-event. And then should you have any questions, we also have a testing event FAQs. And if your question isn't answered in the FAQs, please feel free to email the WA Wellness inbox, or you can get in contact with your Washington Wellness representative for any of the questions that you have. Step 2 is promoting your event. So we have several different material to help you with this. We have a DPP introduction flyer, and we have a reminder flyer. You can post these anywhere within your agency following your facility guidelines. We also have 3 different brochures for you to use, which has a detailed overview of the diabetes prevention program. Very similar content, just kind of with their own each unique and look and feel, so feel free to pick one that works, that you like. Step 3 is actually holding your event. So we have a little bit of information about testing event, the providers procedures, and then testing event and classes, the coaching procedures. And you can bring these to the event with you, just so that you have them, so you have an expectation of what the providers and the coaches will actually be providing and how that actually works. And then step 4 is that we have a testing feedback survey. So at the end of each testing event, we would like to get your information about how the event worked for you, what you liked, what you didn't like, and any things that you have for improvement. So please feel free to fill out that feedback survey and send that to the WA Wellness resource. All right, so next, once you've kind of gone through that whole website, it'll be, oops, sorry about that. Let me get back to where I was. Each agency and their organization is encouraged to adopt its own wellness policy. This just kind of helps leverage being able to offer the diabetes prevention program. If you need an example of what this looks like, feel free to email your Washington Wellness representative, and we'll be happy to show you some examples that we have about incorporating diabetes prevention in a wellness policy. Okay, so a little bit about the DPP planning process. So fill out the DPP request form, and I would like to just go through this form with you guys so you can see some important parts of it. So let me bring this form up for you. So this is what our DPP request form looks like. Very similar to what we had before. There are a few slight changes. The top part of the form just is your name of your organization and the date of request, your first name, and some contact information for you. We really would like to have this form sent to your Washington Wellness representative at least 45 days before your actually testing event. We do understand that sometimes things come up and you'd like to have things a little bit earlier. In most cases, we can try to accommodate that, but do try to get it to us within that 45-day period as best as possible. So a little bit about the actual testing event. So this section right here is where you can actually fill in the testing contact information. It's important to have a backup content. It can just be somebody who's on your wellness team. And the reason why we have this is so that if you happen to be gone or get stuck into a meeting when YMCA and Workwell consultants show up to your organization, we have somebody who we can get in contact with. Next is about the event planning. How many events would you like to hold? You can just indicate how many is going to be there. Can non-employees attend? This is where you're going to want to indicate whether they can or whether they can't. It's entirely up to you and your organization and what you would like to do. So just indicate which one it's going to be. If there's anything specific about the event that we would like to know, this is the box where you can put in that information. Details of the event number one, so event title. You can make up your own title. If it's part of a health fair, you can, just say, it's HCA's Wellness Fair or whatever it is that you want to put. You can enter your event title. And this is a title that's actually going to be used so when people register for the program, they'll be able to see this name. The total number of eligible employees and projected number of participants, it really is kind of hard to project exactly how many people are going to participate. Typically with those that are an organization with around 800 to 1,000 employees, we usually see around 50 or 60 people. So do your best in trying to fill that out. If you need help, your Washington Wellness person will be able to kind of help guide you on that. Here's where you're going to put the requested date, the start time, end time. Again, remember that this is a fasting blood glucose test, so you want to make sure that your times are going to work with that type of a test. Indicate the location name and the address of where it's going to be, because this is what is going to be given to Workwell consultants in YUSA so that they know exactly where they need to go. And if there's any special parking or landmarks, especially those for Department of Corrections or other high-profile agencies, make sure you indicate what those are going to be in any directions that you need them to follow. Classes, just some contact information about who we should contact for the classes. And again, is the classes just for employees or can dependents and families still participate in those? We do have a room requirement checklist. So please go through and check all these. We really would like to have the room available for 20 consecutive weeks, and that's just in the event that there's any makeup sessions due to inclement weather or anything that could potentially happen. You want the room to be able to accommodate at least 16 people. A whiteboard and a flip chart with markers is best, and enough space where participants can move around. So here's where you can enter the information about your actual class series, start date, end time, and then any directions for parking, and will there be any scheduling exceptions during the class series one. So you'll punch if there's going to be a room change. If it's not going to be in the same room consecutively, you can just indicate, hey, there's going to be a room change at this week, just so that the people understand where it's going to be. And then once you have all this done, you can send your form to the Washington Wellness inbox, and then we'll get in contact with you to go over those items. Okay, so once you send your form, your Washington Wellness representative will contact you to make sure that everything on the form is what you intended it to be and everything is filled out correctly. We'll finalize the form. That form will then get sent to YMCA and to Workwell Consultants, where we then will have an implementation call. And again, that implementation call really is for the wellness coordinator. We want to make sure that it's going to be for a customized experience for you. And Workwell Consultants and the Y really tries to make sure that we do that. And then once that's done, then we go ahead and we have the event. So let's take a look at some common questions that we have related to the diabetes prevention program. So how does the billing work? When you attend the event, we try to encourage employees to bring their insurance card. Workwell Consultants will take care of all the billing for you, so you as a wellness coordinator, you don't have to do anything at all for it. The testing classes are a fully covered benefit for employees who have a medical plan through the PEB program. We do run into occasion where there are those people who do not have a PEB plan. Right now, we're currently exploring relationships on how we can bill for TRICARE. Oh, looks like we're having some technical problems here.
go drop down show. This application is paused.
So my screen?
Yeah. All right.
Okay, sorry about that. Looks like we screen didn't refresh over here. I'll just kind of back up a little bit on the common questions. How does the billing work? When you attend the event, we just try to encourage you, and typically what happens is the wellness coordinators will send an email out letting people know to bring their, have employees bring their insurance card, and then Workable consultants will take care of all of the billing for you. The testing classes, they are fully covered benefit for employees who have a medical plan through the PED program. And we do run into those people who have other health plans such as TRICARE. We are currently exploring whether this is something that Workable Consultants is going to be able to bill or not. And so we'll have further information on that soon. Okay, some other questions that we have is leave needed for participation in screening events? Thanks to Governor Inslee's executive order, which allows employees of higher education institutions and state agencies to take 30 minutes from work time to participate in an event without taking leave. Leave isn't necessarily required. However, do talk to your organization for guidance on this. Participation in the classes is not on paid time, but supervisors has discretion regarding allowing employees to flex their schedule for this. Are there other options to the blood test? Yes, there are other options to the blood test. If an employee is not able to do that, do the finger poke. There is the risk quiz that I mentioned earlier that if you score a 9 or higher, you can use that as well. And again, we are exploring other forms of tests to see if it's something that we would be able to do as well, such as like an oral glucose test. Some questions relating to privacy is, will my employer see my results? No, your employer will not see your results. It's kept between Workable Consultants and YUSA. What will Workable Consultants do with my results? Depending on the results, they'll either refer you to the on-site YMCA coach or they'll send you back to your office because you are not in need of those types of services. Will Workable Consultants share results with my health plan? No. The only info that is shared is if you took a test, and that's just strictly for the purposes of billing. There's certain codes that they have to bill for that, and if you participated in the diabetes prevention class. Does participating in this event increase my medical cost? No, there is no cost for the employee to participate in the class. It is there is no increase in medical costs. Your premium doesn't go up and your deductible doesn't go up because you decided to participate in the class. Okay, so lastly we have a closing video about prediabetes. This was put together by the Diabetes Network leadership team and the Ad Council, and this was broadcast nationwide about prediabetes. It's a great way to kind of think about prediabetes, and I thought it would be kind of too good to share this with you guys. So let me bring this up here and hopefully the audio and everything will come through on your guys' end.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
We will go ahead and take a look at any questions that we currently have, and if there are questions, we'll address those, and we'll wait just a couple minutes for those to come through. Okay, so one of the questions that we have was asked about the, do we have a list of DPP classes available statewide? Not sure if the Y has coverage statewide. Would be most helpful to have the contact information and location. So right now we don't, the DPP classes, we're working on finding out where those are going to be. The Y is putting together a list of those that are not going to be part of the ones that we do with the agency. So as soon as we have that information in terms of where those are going to be within the community, we'll make sure that we pass those out to you guys. We had another question about TRICARE insurance. Previously in the past with our previous vendor, they were able to bill TRICARE. With Workwell Consultants, we're currently looking to see if that's something that they have set up with them or not. And you know, we're just waiting to hear back on if that is the case. So as soon as we have that, then we'll let you guys know. Another question we have, is there a minimum number of testers needed? There isn't technically a minimum number of employees to hold a testing event, which I presume is what that question is aimed at. We'd like to have as many people as possible. We do realize that with this type of test, with a fasting blood glucose test, that it's, you know, we may not necessarily get as many people as what we're hoping for, but you know, we do have other means to be able to be tested as opposed to just doing the blood test, like using the CDC risk score as well. But in terms of like an actual number of employees, you know, as long as we have interest and the people who are willing to do it, then Workwell Consultants and YUSA are willing to show up to the state agencies and our other higher education institutions. Another question we have is, will we get notified of testing events at larger agencies so smaller agencies may attend? The answer to that is yes. We are going to work on trying to do multiple events that are kind of combined together, especially like in the Spokane, Eastern Washington region where there's a lot of smaller different agencies and organizations. We're going to try to do grouped events so that more than just one can participate in them. And so we'll work with you and let you know what other organizations are able to participate in that at the same time. Okay, that looks like that's the rest of the questions that we have. I do want to just, while you guys are here, let you know about our next webinar that's going to be coming up. It's the title of it's going to be Wellbeing Assessment Report Webinar. It's going to cover the what is the Wellbeing Report, why it's important, and how you can use it to improve your own wellness program. It is going to be a webinar fashion on Thursday, July 13th from 10 a.m. to 11 a.m. We will have a recording be available afterwards, and feel free to go to the Washington Wellness page under training for more information, or feel free to contact your Washington Wellness representative. So with that, thank you very much for attending this webinar. If you have any questions for us that you think about later, please feel free to reach out to your Washington Wellness representative. Have a great rest of the weekend.